Hi guys, so for my major theme, I wanted to talk about the importance of patient-practitioner relationships, as well as briefly touch on the importance of the interprofessional relationships between the patient's healthcare team. In the book, the authors talk about the structural and non-structural components of healthcare, and that these can create supports or divisions among the members of the patient's healthcare team, and then also the patient and the practitioner. So structural includes like just the location of the practice, the specialty, and the pace of work. And then non-structural include personal traits such as psychological and intellectual characteristics. So many of these kind of divisions stem from one of the original models, which is the biomedical model of care, and which is found throughout many professions, including occupational therapy. One difference, though, is that occupational therapy first began as a holistic profession, more based on work than it was medicine. And then after the war, they switched over to more of the medical model, and because they needed more professionals, and they also needed to prove the efficiency, and they wanted recognition from the American Medical Association as a profession. And then over the past 100 years, occupational therapy in the United States had its centennial last year. We've shifted back towards a holistic, more client-centered point of view, but while still balancing the importance of evidence-based practice. That way we can continue to show the validity of our therapeutic interventions. So the book also talks about alternative models, such as the biopsychosocial, patient-centered, and relationship-centered care models. They have all been supported as a way to create a cohesive patient-practitioner relationship. They're very client-centered, and they place the client's story as well as the client at the center of their relationship as patient and practitioner. What I love about occupational therapy is that from day one we are taught that it is a client-centered practice, that we have client-centered models, and that we are a holistic practice, really looking at the person as a whole, their strengths, and then areas of potential improvement, and we move on from there. So I love that kind of related back to these alternative models rather than the biomedical model. So I wanted to briefly touch on some other models of occupational therapy. Since you guys are PAs, I thought it'd be kind of fun to talk to you about two of our major models, or the two that I think are major models. There are a lot of models for occupational therapy. One is called the Model of Human Occupation, also known as MOHO. And these come from one of our OT textbooks called Applied Theories in Occupational Therapy, A Practical Approach. So MOHO essentially looks at the interactive and cyclical nature of human interactions between the human and the environment, as well as looking at the individual's particular sources of motivation, their behavior patterns, and as well as their performance patterns. So they really understand the patient's life and life story as a cycle and as totally interactive between motivation, behavior, performance, and environment, all focusing with the client. We prefer, in our profession, we're taught to use client over patient. I'm not sure why. Maybe because we're trying to be less medical minded. Let me know if you guys have any thoughts on that. But I like MOHO a lot. I think it's interesting because it encompasses so much of what makes a person in a way that's easy to analyze as a model. And then another one that I like is called PEOP. It's the Person, Environment, Occupation, Performance Model. And it wants you to look at like kind of almost like a Venn diagram comparing the person and the environment, and then the occupation, which at the center is the performance. So all of both the person and their person factors, the environment and environmental factors, and then occupation that they want to do, and the factors that encompasses, sorry, I'm having a hard time with that word today, and how they all interrelate to create this occupational performance, and how if one area is lagging or one area is overpowering, it can create an imbalance and therefore an occupational dysfunction, which all impact your ability to perform in your life. So any area of occupational dysfunction can create dysfunction in your life roles. So then for my I wanted to really quickly talk about the importance of the relationship between the interprofessional teams that's often made up of a medical team between patient and practitioner. So one of the major things that I noticed was that the efficiency and effectiveness of the interprofessional team and the collaboration they have can have a great impact on the patient and practitioner relationship, which I thought was cool because if you have effective communication, you're not all asking the patient the same thing, and you're not all doing the same kinds of assessments, and you can build upon each other and what you've learned. So saying, well, I've understood, and respectfully following HIPAA, of course, but saying, this worked well, this type of communication style, I learned this and this about this person, can make a big difference in your effectiveness and efficiency as a team member, and it can also help you develop your patient-practitioner relationship. I'm just trying to keep an eye on time. Working as a team, not a single person has to do everything. You can all do a little bit of it, and the end goal, the patient benefits, perhaps your outcomes as a physician and the patient outcomes improve. As far as spiritual care skills that are needed to effectively address patients as a whole person, especially in complex and complicated healthcare situations, you need to have communication between the patient and the practitioner. You need to have communication between the interprofessional members of the team, and you need to have collaboration. You need to have active listening, and this class has really taught me a lot about the importance of narrative storytelling. For my alternative kind of source, other than the textbook, of course, I wanted to talk about a video that I found. It is by a man named Dr. Marcus Tower, and he's the medical director of gynecology and care management at the Cleveland Clinic Foundation and Hillcrest Hospital. And he has a video about improving patient and practitioner outcomes. I liked it because it was really short. Half of it talked about patient-practitioner outcomes, half of it talked about empathy and compassion. So it was interesting because he's obviously kind of a medical director, so his approach was focused a little bit on improving outcomes, but in a way that still emphasized the importance of communication between the patient and the practitioner. So some of his key points was that it can improve both patient and practitioner outcomes, and it really creates a sense of cohesion as you're working together to create a better outcome for the patient. That's your goal as a physician, right? To have the patient have improved performance. He also mentioned that it can create an emotional tie to the patient, which we've learned is important to create the emotional tie, but in a way that's not causing burnout, because if you block all of the emotions out, you can have burnout, but if you, quote, feel too much, you can also have burnout. He said the importance of feeling satisfied and happy as your patient improves and then as your patient care improves. He stated that you don't necessarily want to be friends, but it creates this relationship and a dialogue of communication, which is really important. And he touched on the fact that by having this strong patient-practitioner relationship, you're able to explore their concerns from their personal perspective, client-centered, and then you can be really attentive to their concerns and desires in your treatments while also still doing what you think is medically necessary. For my personal story, I wanted to talk about this woman that I see at the facility I'm at right now, so I can't give you too much information, but amongst a variety of things, she has very minimal, poor communication skills. So she can answer yes and no questions, and she can hear everything you say. So imagine what a struggle that is for some staff who don't totally understand her. They assume that she can't understand what they're saying, and so they'll talk about her right in front of her, and she can hear everything. So it's really heartbreaking. So then when she's frustrated and she wants or needs something, whether that's she wants her fan turned on or her lights turned off or her TV on or off, or if she wants to go sit in the lobby and not be trapped in her room, she'll start to yell. It's essentially the best way to describe it. Yell or scream. And we have to think that a lot of these people that I'm working with, as I've told you kind of throughout the course of the semester, a lot of these people developmentally similar to an infant. So when an infant can't express, well, that's how an infant expresses what they want or need. is through screaming and crying, so why would we expect these people to not do that, I guess is a respectful way to say it. But she will scream, and then the staff will get frustrated, and they won't take the time to ask her what's wrong. And don't get me wrong, it is frustrating and it is challenging. I've been there. But they instead just kind of close the curtain on our room, and they'll just leave her and say she's having behavior. So if maybe the staff needs additional education on communication and how to effectively listen and understand her, then that would be helpful. And I think we also could work on her ability to communicate effectively with the staff, taking a breath, realizing that things will get solved faster if she takes the time to answer yes or no questions, and develop other means of communication. Because communication, even with those who have limited verbal skills, is still such an important part of the patient-practitioner relationship. Well, sorry I went over a little bit. I was trying to answer all of the questions. I'm looking forward to hearing you guys' videos, and it's been nice getting to know you a little bit through this class. Bye.